Understanding flu symptoms. A comprehensive guide. Hi everyone, and welcome back to my channel. Today, we're diving deep into a topic that's especially important as the colder months set in, the flu. Whether you're feeling a little under the weather, want to learn how to recognize flu symptoms early, or are looking for tips to protect yourself and your family, this video is for you. We'll cover what the flu is, how it spreads, its most common symptoms, how it differs from a cold, when to seek medical attention, complications you should be aware of, effective prevention strategies, and even some trusted home remedies to make flu season a little easier to handle. If you find this video helpful, don't forget to hit that like button, subscribe to my channel, and click the notification bell so you don't miss any future updates. Now, grab a cup of tea, get comfortable, and let's get started. What is the flu? Let's start with the basics. The flu, or influenza, is a contagious respiratory illness caused by influenza viruses. It affects the nose, throat, and sometimes the lungs. While it's common, the flu is not something to take lightly. It can cause mild to severe illness, and in some cases, it may lead to hospitalization or even death. Flu season usually runs from late fall through early spring, and the virus spreads rapidly during this time. But how exactly does it spread? Influenza primarily spreads through respiratory droplets. When someone who is infected coughs, sneezes, or even talks, tiny droplets containing the virus are released into the air. If these droplets land in your mouth, nose, or even your eyes, you can become infected. The virus can also survive on surfaces for a time, meaning you can catch it by touching something contaminated, like a doorknob or your phone, and then touching your face. That's why frequent hand washing and good hygiene are so important during flu season. How common is the flu? Each year, millions of people contract the flu. According to health organizations, flu viruses infect between 5–20% of the population annually, depending on the severity of the season. This translates to thousands of hospitalizations and, unfortunately, deaths, particularly in vulnerable populations such as young children, elderly individuals, and those with compromised immune systems. Understanding the flu isn't just about protecting yourself. It's about reducing the spread and ensuring your community stays as healthy as possible. Common symptoms of the flu. The flu doesn't sneak up on you. It hits suddenly, and the symptoms can be intense. Let's break them down. 1. Fever or chills. A high fever is one of the most recognizable symptoms of the flu, though not everyone will experience one. Fevers often come with chills as your body tries to fight off the infection. 2. Dry, persistent cough. A flu-related cough is usually dry and can make speaking or breathing uncomfortable. It often gets worse over time. 3. Sore throat. Many people with the flu report a scratchy or painful throat, making it uncomfortable to eat or drink. 4. Runny or stuffy nose. Nasal congestion can make you feel miserable. You might alternate between blowing your nose constantly and feeling completely blocked. 5. Muscle or body aches. One of the most defining symptoms of the flu is how achy it makes you feel. Your muscles might feel sore, and even simple movements can feel exhausting. 6. Headaches. Flu-related headaches can range from mild to severe and are often accompanied by other symptoms like fatigue or fever. 7. Fatigue. Extreme tiredness is a hallmark of the flu. It can leave you feeling drained, even after a full night's sleep, and may linger long after the other symptoms have resolved. 8. Gastrointestinal symptoms. Though less common in adults, some individuals, especially children, may experience nausea, vomiting, or diarrhea alongside other flu symptoms. How flu symptoms differ from a cold. People often confuse the flu with the common cold, but they're not the same. Here's how you can tell the difference. Onset. The flu comes on suddenly, while cold symptoms usually develop gradually over a few days. Fever. Flu often includes a high fever, colds rarely do. Body aches. Flu causes more severe aches and pains compared to a cold. Fatigue. Flu-related fatigue is intense and can last for weeks, while cold fatigue is milder and short-lived. Duration. Flu symptoms typically last longer, often 1 to 2 weeks, while colds resolve more quickly. Understanding these differences can help you determine whether you're dealing with a cold or something more serious. When to see a doctor. While many flu cases can be managed at home, it's crucial to know when to seek medical help. You should contact a healthcare provider immediately if you experience difficulty breathing or shortness of breath, persistent chest pain or pressure, sudden dizziness or confusion, severe vomiting, or an inability to keep liquids down, symptoms that improve but then return with a higher fever or worse cough. High-risk groups, including young children, the elderly, pregnant individuals, and those with chronic conditions, should be especially vigilant. Complications from the flu. The flu isn't just uncomfortable, it can be dangerous. Complications include pneumonia, a severe lung infection that can be life-threatening; bronchitis, inflammation of the bronchial tubes, leading to a persistent cough; sinus and ear infections. These can develop when mucus builds up; worsening of chronic conditions. The flu can exacerbate existing issues like asthma, diabetes, or heart disease. If you're at higher risk of complications, early treatment can make a big difference. Preventing the flu. The best way to prevent the flu is through vaccination. Getting a flu shot each year significantly reduces your risk of contracting the virus and protects those around you. Here are some other tips to help prevent the flu. Wash your hands frequently with soap and water. Use hand sanitizer with at least 60% alcohol when soap isn't available. Avoid touching your face, especially your mouth, nose, and eyes. Cover your mouth and nose when you cough or sneeze, preferably with your elbow or a tissue. Stay home if you're feeling unwell to prevent spreading the virus. Home remedies for flu relief. While rest and hydration are key, many people find relief with home remedies, such as honey and lemon tea. Soothes sore throats and provides a bit of energy. Ginger tea helps with nausea and has anti-inflammatory properties. Saltwater gargle reduces throat pain and clears mucus. Steam inhalation relieves nasal congestion and soothes the respiratory system. Myths about the flu. Let's clear up some common misconceptions. 1. Myth: the flu vaccine can give you the flu. Fact: the vaccine contains inactivated virus particles that cannot cause illness. 2. Myth: cold weather causes the flu. Fact: the flu spreads through respiratory droplets, not temperature changes. 3. Myth: I had the flu last year, so I'm immune this year. Fact: different strains circulate each year, so vaccination is still necessary. Thank you so much for joining me for this comprehensive guide on flu symptoms. I hope this video has helped you better understand how to recognize, prevent, and manage the flu this season. If you found this helpful, please give it a thumbs up, subscribe, and share your thoughts in the comments below. Stay safe, stay healthy, and I'll see you in the next video.